Dr. Bedelia, how do you rate where America stands in dealing with this pandemic as we begin the summer season where people are hoping to resume normal summer activities?
Yeah, Lawrence, overall, we're incrementally getting safer, as Dr. Fauci said. You're rating these great numbers overall, over 60%. And the precaution here is that underlying that are two trends. Interstate difference. There are states that are farther behind, states such as Louisiana, Mississippi. You're seeing 30-40% of the population with one dose. And then you're seeing intrastate differences where you're seeing some parts of even states like Massachusetts, for example, with high rates of vaccination. You may see in Western Massachusetts communities that have lower rates of vaccination. And you're seeing trends where it might be communities that are having harder time taking time off work to go get vaccinated, right? And that's work that we need to do to ensure to remove those barriers. And then there's communities elsewhere in the country where potentially COVID was not considered as big a threat. And, why would you take a vaccine now when it was not considered a threat in the past? And that's where education and engagement and importance of the vaccine, not just for individuals, but the entire community to be safer, is still going to be so necessary moving forward.
And going forward, will the recommendations for what vaccinated people can do be changing in any significant ways?
Well, currently, I think the CDC recommendations are already, great for if you're vaccinated, you can travel. You can gather in groups. You don't have to wear masks. I think that the things that might affect whether or not those recommendations change is, as you again heard Dr. Fauci say, one, the rate of our own vaccination in this country and the appearance of new variants. You mentioned the UK situation. Now that's an interesting one because they're about on par with us, a little ahead of us in vaccinations, and they're seeing their cases go up again. And it is driven by these new variants that's more transmissible, but may also decrease the effectiveness, at least in people who've just gotten their one dose. And that's why the speed of vaccination here for us in the U.S. is going to be important as much as the coverage is, because we've always been about a week or two behind the UK, as you know, when these new variants appear.
President Biden has set another deadline that it probably was not part of their original plan to set, and that is this new 90-day deadline for an investigation of the origins of COVID-19 and might it have been from a laboratory leak in China, and what does it matter to us at this stage in terms of fighting this vaccine? How does the origin matter now that we have vaccines that work against it?
Well, you made a very important point. Immediately in this fight today, the important thing is that we get vaccines everywhere where there is possible to get the vaccines. And that's where the big fight is for all of us to return to normalcy. The tough part here for me with the vaccine, the conversation about the origins, is how clouded this has become in politics. A question of could there have been a leak, from the laboratory? The chances are it was much smaller than the fact that this would have been a virus of natural origin. However, it should be investigated. The thing that clouds it a little bit is that it's clouded by domestic politics here in the U.S., and it's also clouded by geopolitics on the international scene between U.S. and China and WHO. And as a scientist, as a physician, the question is, how do we get to that scientific question and leave the politics behind? And that's a very tough situation right now when there's such other bigger geopolitics that are involved.
And in terms of vaccine availability now in the country, have we reached that point where it is, you could describe it as being so easy to get that all you're up against now is people either having difficulty scheduling because of work or hesitancy?
That's right. Availability here in the U.S. is going to be very high, to the point where the Kaiser Family Foundation actually says that in their report, by the end of this year, the U.S., having vaccinated, after vaccinating everybody over the age of 5, will still have about 1 billion doses in surplus. And so it's really, as you said, Lawrence, it's not availability, it's now accessibility and people's, actual ability to want to get the vaccine. And that's why I think recognizing and doing education around the fact that this is how we get to the other side, like, this is how we return to a normal summer, is going to be so important for all of us.